everyone. I'm Mrs. Princey, Associate Professor in Mental Health Nursing. Today I'm going to talk about another important topic, which is the sexual disorders. So let us see the meaning of sexual disorder. Any disorder that involves sexual functioning, desire, or performance is termed as the sexual disorder. Another definition I've got: sexual disorder is the difficulty experienced by an individual or by the couple during any stage of the normal sexual activity, including physical pleasure, desire, preferences, arousal, or orgasm. So it is the disorder which can be seen in the individual or in the couple who face any kind of a difficulty related to the sexual dysfunction or the orgasm, the pleasure, desire related to the sexual activity. So such disorders are termed as the sexual disorders. Let us see the classification of the sexual disorders. So we have got the first one, which is the gender identity disorder, psychological and behavioral disorders associated with sexual development and maturation. The third one, we have got disorders of sexual preferences. The last one is the sexual dysfunction. So this is the classification of the sexual disorder. Let us see about each of it in detail. The first one is the gender identity disorder. So as the name says, gender identity disorder, the person will have the difficulty to identify his own gender as to, whatever the particular gender that he is unable to identify that particular gender. Gender identity disorder, GID, are defined as disorders in which an individual experiences or exhibits marked and persistent identification with the opposite sex and persistent discomfort with his or her own sex, or the sense of inappropriateness in the gender role of that sex. Okay, so here the person feels a lot of discomfort and persistently he feels himself to be identified as the opposite sex, and he feels very inappropriate to assume the gender role that he has got. So if you take the gender identity disorder, it is being classified further into the first one, which is the transsexualism, gender identity disorder of childhood, dual role transvestism, and intersexuality. So what is this transsexualism? So it is a sexual disorder or a gender identity disorder wherein the person feels the consistent, strong desire to change his or her anatomical gender. Some of these transsexuals were misassigned gender at birth. That means a person who is anatomically male but was raised as a female. So that is termed as the transsexualism. So here the person feels to, or he has got a strong desire to change his one's anatomical gender. Okay, that is called as the transsexualism. The second one is the gender identity disorder in the childhood. So this particular sexual disorder is usually manifested during the childhood period, especially during the pre-pubertal stage of development, characterized by persistent and intense distress about, together with the desire to be of the opposite sex. So during the childhood period or just before the person or the child attains is puberty, before the puberty, the person or the child feels to have the uncomfortable feeling or thought about the gender that they are assigned of, and they feel a strong desire to change their gender. So that is called as gender identity disorder of childhood. The next one is the dual role transvestism. So what is this dual role transvestism? So here, as the name says, dual role, the person feels to have the dual role in terms of the gender, right? So here the person will practice certain practices like wearing the clothes of the opposite gender, that is to experience being the opposite gender temporarily, but he will not have any sexual motive or he doesn't want to have any kind of the reassignment surgery. Okay, so he doesn't want to anatomically change his gender, but he will use the clothes, or he wears the clothes of the opposite sex and he wants to just feel the experience of it for a temporary period. So that is called as the dual role transvestism. The next disorder is the intersexuality. So what is intersexuality? So it is a condition in which the individual will have both the male and female, or he may have the gonadal tissue of one sex and the external genitalia may be of the other sex, or it is ambiguous. Okay, so such kind of a gender identity disorder is termed as the intersexuality, wherein anatomically there is the presence of both the sexual gonads in a single individual. So the individual may have the gonadal tissue of one sex, whereas the external genitalia may be of the other sex. So both the gender role the individual will assume anatomically, that is termed as the intersexuality. So that is the first condition, which is the gender identity disorder, wherein you have learned about the transsexualism, gender identity disorder of childhood. You've got the dual role, transvestism and the intersexuality. Moving on to the next classification, that is psychological and behavioral disorders associated with sexual development as well as maturation. So during the stages of maturation or the developmental stages, there are some changes in the behavior or the psychological aspect of the person which happens because of the sexual development. So what is that? In that first condition we have, which is the homosexuality or the homosexuals. What do you understand by homosexuality? Homosexuality is a condition wherein there is a romantic attraction or the sexual attraction, or we can say a sexual behavior between the members of the same sex or the gender. So there is an attraction towards the members of the same gender. So you can say the examples of gay or the lesbianism, wherein they get attracted towards the same gender. That disorder is known as the homosexuality. So what is the treatment for the homosexuality? You can ask the client to go for a counseling session or the psychotherapy. So we have got various psychotherapies, especially the psychotherapy which is used for such kind of a condition is behavior therapy. So in the behavior therapy, we use the aversion technique or systematic desensitization to help the client to overcome this behavioral disorder. So apart from the behavior therapy, you've got the supportive psychotherapy as well as the psychoanalytical psychotherapy. So all this therapy, if the client had any kind of the unconscious conflict or desire which is stored in the unconscious level of the mind, so all those things will be ventilated out through the catharsis, and he will be able to get the orientation about his own self-awareness about his own self, wherein he will try to have a modification in the orientation related to the gender that he is assuming. Yes, so that is about the treatment for the homosexuality. The next condition is the disorders of the sexual preference, or we can call it as paraphilias. Okay, so disorders of the sexual preferences or the paraphilias. So it is a condition which is characterized by abnormal sexual desires, typically involving the extreme or dangerous activities. Okay, such a condition is called as the paraphiliasis. So what are the disorders which comes under the paraphiliasis? Fetishism. So what is this fetishism? So it is a behavioral disorder wherein the behavior of an individual will be such that he will show the sexual interest towards the objects or in a part of a body other than that of the sexual organ. So that is called as the fetishism. So here the person shows the sexual attraction or a desire towards any kind of the object or any kind of the body part, okay, which is not related to the sexual organ. So that is called as the fetishism. The second one is transvestism. So what is this transvestism? So here there is a practice that an individual will do, especially in case of men, wherein they use to wear the clothes of the opposite sex. So female clothing that they will use just to get the psychological gratification. So that is called as a transvestism, wherein the person, especially the men, will wear the clothes or dresses, they dress up like the female, right? So just to get this kind of a gratification being a female. Okay, that is called as a transvestism. The next condition is the sexual sadism. So what is this sexual sadism? So here the individual will have persistent fantasies in which sexual excitement results from inflicting psychological or physical suffering on the sexual partner. So it may include the humiliation or terror. So they get the sexual satisfaction by humiliating or creating some kind of a psychological or physical suffering to the sexual partner. Okay, so that is called as sexual sadism. So he seems to be a sadistic kind of a person who gets the pleasure only when he does some kind of physical or psychological harm with his sexual partner. Okay, so that is sexual sadism. The next one is a sexual masochism. Sexual masochism is an intentional participation in an activity that involves the humiliation, getting beaten, bound, or otherwise abused to experience sexual excitement. So here the person is having the feeling that he wants or she wants to be sexually abused or humiliated. This humiliation or sexual abuse will cause a kind of sexual excitement. Okay, so that is called as the sexual masochism. So this kind of the behavior causes significant distress as well as impairment in the functioning of an individual, right? So that is the sexual masochism. The next condition in the paraphilias is the exhibitionism. Exhibitionism or the exhibitionistic disorder is a condition which is marked by the urge, fantasy or act of exposing one's genitals to non-consenting people, or especially we can say to the strangers. So a person who just exhibits or shows off his genitals to a stranger, wherein he gets the kind of a fantasy or the sexual satisfaction when he does this particular behavior. So that is called as exhibitionistic disorder. The next condition is the voyeurism. So what is this voyeurism? It is the practice of gaining the sexual pleasure by watching others when they are naked or engaged in the sexual activity, right? So people get this sexual pleasure when they watch the naked scenes or the person who is performing the sexual activity. So that is called as the voyeurism. The next condition is frotteurism. So what is this frotteurism? It is a paraphilic interest in rubbing one's genitals or the pelvic area or the erect penis against non-consenting person or strangers for getting the sexual pleasure. It may involve touching any part of the body, including the genital area. Okay, frotteurism, wherein the person will rub a sexual organ or the genitals or pelvic area to a non-consent person or a stranger, wherein it involves touching or rubbing the other person's genitals or any kind of the body part. The next condition is pedophilia. What is pedophilia? It is a sexual perversion wherein children are preferred sexual object. Specifically, it is a psychiatric disorder in which an adult will have the sexual fantasies about or engaging in sexual act, especially with the pre-pubertal child. Okay, so that is called as pedophilia, wherein the person will have this abnormal, behavior of having the sexual act with the pre-pubertal child. So that is pedophilia. The next condition is zoophilia. Okay, it is otherwise called as bestiality, wherein the person will have the sexual attraction towards the animals. Okay, so that is called as zoophilia. We have got the other paraphilias like conditions where the sexual arousals will happen with urine, feces, enemas, etc. So that is called as, other paraphilias. So these are the conditions which comes under the category or the classification of the paraphilias. So under the paraphilias, we have got the fetishism, transvestism, sexual sadism, sexual masochism, exhibitionism, fruitism, pedophilia, zoophilia, and other paraphilias. Now, moving on to the treatment. So, what is the treatment modality? So, number one treatment is the behavioral therapy. We need to bring about a modification in the behavior since it is causing a behavioral problem. So, we'll be doing a aversion therapy wherein it will be paired with the counter conditioning that associates with the unpleasant state with unwanted behavior. The next treatment is the psychoanalysis via the dream analysis or free association, abreaction therapy. So through all these, the unconscious conflicts will be resolved. So that is about the psychoanalytical therapy. So apart from this, we have got the drug therapy, especially or having this psychotic behavior, right? So will we put on the antipsychotic drugs, and that kind of a treatment modality may be useful for some individuals, right? So this is about the treatment modality for the paraphilias. The last condition or the classification we have is the sexual dysfunction. So what is this sexual dysfunction? It refers to the condition wherein there is a problem occurring during any phase of sexual response cycle that prevents the individual or couple from experiencing the satisfaction from the sexual activity. So we have got a cycle of sexual arousal. So an individual who is having a difficulty to gain the satisfaction from the sexual activity, wherein there may be problem with any stage of the sexual response. So that condition is called as a sexual dysfunction. If you take the sexual response cycle, mainly it has got some phases. So which includes the excitement phase, plateau phase, phase of orgasm, as well as the resolution. So these are the four phases if you take the sexual response cycle. So individual who has any kind of a difficulty in any of these phases will be termed as the sexual dysfunction. What are the common sexual dysfunctions? So we have got a list of the common sexual dysfunctions. Number one, frigidity. So what is this frigidity? Here, the person will have the absence of the sexual desire for involving in the sexual activity. The desire for sexual activity itself is absent, which is termed as frigidity. The second condition is the impotence. So it is a disorder characterized by the inability to have or sustain the penile erection till the completion of satisfactory sexual activity. So here the person is not able to have or sustain the erection till the completion of the sexual activity. So that is called as the impotence. The next one is the premature ejaculation. So what is premature ejaculation? So it is a type of ejaculation which happens sooner than the male or a sexual partner would like to have during the sex. Okay, so that is called as premature ejaculation. Before even the person or the sexual partner feels to have the sex, there is a ejaculation which happens. Occasionally, this premature ejaculation is termed in different terminologies like rapid ejaculation, premature climax, or early ejaculation. So a person with this kind of a difficulty may not worry, but he may have the frustration that it makes the sex less enjoyable, or the partner may just complain that he or she did not enjoy the sexual activity, wherein it can have an impact on the relationship. Okay, so that is called as the premature ejaculation. The next condition is non-organic vaginismus. So what is this vaginism? So what is this vaginismus? Vaginismus is caused by spasm of the levator ani muscle, which encircles the lower third of the vagina. This kind of spasm or the constriction can totally occlude the vaginal introitus. So, because of this, spasm of the lower third of the vagina, the person or the lady may have this, dyspareunia, painful sexual coitus, right? So, you need to evaluate whether the cause is the spasm of the lower one third of the vagina, it's really vaginismus, or whether it is a psychological condition wherein the women experiences the painful coitus. The next condition is non-organic dyspareunia. Dyspareunia is a painful sexual intercourse due to the medical or psychological cause. So there is no organic cause there, but the cause can be a psychological cause or a social cause which can make the person to end up with this painful sexual intercourse. That is called as non-organic dyspareunia. So these are the conditions which comes under the sexual dysfunction. So under the sexual dysfunctions, you have got frigidity, okay, you have got impotence, premature ejaculation, non-organic vaginismus, as well as non-organic dyspareunia. So what is the treatment? The treatment of choice is the psychoanalysis, since the client may have so many unconscious desires or conflict or the needs, wherein only through the psychoanalytical therapy or through the hypnosis the person will be able to reveal that and will be solving his or her psychological conflict. Apart from psychoanalysis, you can go for a group psychotherapy wherein people with the similar condition will be able to gather and will be able to communicate their concerns, and they will be getting the suggestions and the reinforcement. Next therapy is the behavior therapy. To bring out the modification in the behavior, you're going through a behavior therapy wherein the aversion techniques or the desensitization techniques can be used. So that is about the treatment modality for the sexual dysfunction. So these are the various disorders which comes under the sexual disorders. Moving on to the nursing management. So when it comes to the nursing management, the number one thing you're going to do is the nursing assessment, wherein you're going to collect the information or the history about the stressor, the conflicts the person is undergoing, or what kind of a relationship they're having related to the sexual function. What is the history that you need to collect? So information that you're going to collect. So what is the intervention? So we have got some list of the interventions as nurses what you're going to do. First thing is you're going to assess the client's sexual history and previous level of the satisfaction in the sexual relationship. So how was, pre-morbid personality? How was it before and how was it now? What is the history related to the sexual satisfaction of the relationship that you're going to assess? You're going to assess the client's perception about the particular problem. So what he thinks about his issue or the concern, that also is very much important, which will help in the planning. You need to assess the cultural, social, ethnic, racial, as well as the religious factors that may be contributing to such kind of the sexual practices. So you need to find out what is the factor which is contributing to the sexual disorders. Find out if the client is using any kind of the medications which may be affecting the libido of the person. Okay, very, very important. He may be having, XYZ conditions or medical problems for which he is taking the treatment. So, such medications can cause an impact on the libido of the person. So, find that out. So as a nurse, it becomes very important to provide the information to the client related to the sexuality, sexual functioning, and also if the client is having any kind of a misconception about the sexual practices, you need to identify that and you need to give the correction for the misidentification. And you need to give the correction for this kind of the misconceptions. Health educate the client that sexuality is a normal phenomena which occurs in everybody's life. That is a normal human response among one's self-concept, body image, family, and the cultural images. So, sexuality is having the interrelationship with the one's self-concept. It can be the culture, it can be the family. So, all these are interrelated with the sexuality and it is a normal human response. So, educate these things to the client. If the client is having problems with the sexual relationship with the partner, or it becomes very severe, not able to solve, then it becomes necessary that both the client and his partner may require an additional assistant to come out of these problems. So in those cases, you can refer the client or the couple or the partner to the additional counseling. So we have got the sex therapy or the sex therapist, wherein they can do the needful for such kind of the individuals. As a nurse, it's very, very important, since a client with a sexual disorder most of the time will be undergoing the psychotherapy in terms of behavior therapy or psychoanalysis. You need to assist the therapist in the plan of behavior and modification, which is really going to help the client to bring about a modification in the behavior. So, as a nurse, it's very, very important that you should keep in confidence all these information, because these are very sensitive issues which happens in the life of the person, which is causing a lot of distress to the client. So it becomes necessary that the nurse should always keep the principle of being non-judgmental, and as well as accepting the patient as is, so that those problems which the client feels very much sensitive should be communicated, so that he will be able to overcome those sexual related problems or the disorders. Okay, so these are some of the nursing interventions which the nurse can help the client to overcome the sexual disorders. Hope you all have understood the topic. Thank you.